I also want to thank all of you. I feel like this was the perfect way to end the day. It was such a great and stimulating discussion to think about, where do we go from here? Earlier today, Diane talked about how our healthcare system is perfectly designed to get the results it gets. And I think in recent years, there's been a lot of effort to try to redesign that system, to try to redesign care delivery, to improve care for people with serious illness. But you can only get so far with care delivery redesign alone. And I think that's why we're here today. Financing and payment strategies that support these innovative care delivery models are absolutely crucial to their success, and especially to their sustainability over time. You can create the best program in the world, but if you can't figure out how to keep it going because you can't get the financing in order, where are you? Today we heard from some of the innovators in the field that have worked very hard to figure out financing for their programs and have had to work, I think as Anna and Vicki said, to continually adapt their efforts to try to keep financing in place to support improved care for this population. We heard about some of many challenges that come up, including workforce challenges and challenges related to quality measurement, which is such an important part of value-based purchasing and trying to make sure that quality is improved. I want to put in a plug for our next workshop. The topic will be in the implementation of quality measures for community-based programs, and that workshop will be in next April 2018. So I hope some of you will be able to join us for that. And then finally, or a couple more comments, actually, not quite finally. Senator Wyden, I think earlier mentioned we might be at an inflection moment, I think he called it. And so I hope the discussions today have inspired all of us to pursue and think about pursuing a parallel track. On the one hand, thinking about short-term changes we might be able to make, things that Sherry alluded to earlier, possibly changes in guidance, things we could do without too much effort in the shorter term, as we continue to think about the long-run changes that we really feel need to happen to try to address the problems and issues that Ralph and Patricia faced. And to push the care delivery and financing systems forward so that we can really meet in a meaningful way all the needs of people with serious illness. So I wanted to mention a couple of other things. Mark and I really want to thank all the speakers today for sharing their expertise. Thank all of you who've participated both in this room and through the webcast for their participation. I have to again say a huge thank you to Lori Gregg and Solara Cruz, who, those of us on the Planning Committee know, I want to thank the Planning Committee for all their efforts, but really Lori and Solara do 99% of the work to make these workshops a success and to make them interesting and important experiences for us. So thank you very much. I don't know, oh, there they are in the back. And then the final thing, we ask you, if you can, to complete the workshop evaluation form to give us feedback on what we could do to continue to make these programs useful and meaningful for you going forward. So thank you all very much.